And to start with, one of your questions. One of you has written in to ask, I'm confused about the guidelines on moderate exercise. I haven't got a clue what moderate actually means. Well, we sent Casey Beros out to the Baker IDI Institute for Heart and Diabetes Research in Melbourne to speak to an international expert in this field to find out.
Moderate intensity exercise is an intensity where you're sweating and you're puffing, but you can still hold down a conversation. Now, the workload that's required to achieve that moderate intensity is different for different people. People who are relatively less fit will require a lower workload to achieve that intensity, whereas people that are very fit will be doing a much higher workload to achieve a moderate intensity. And one way of monitoring that is actually to work to a particular heart rate. What you can do is actually calculate a heart rate that's in the zone of 60 to 70% of your maximum heart rate.
Now, don't get put off by this, because bottom line, moderate exercise is when you're just beginning to find it hard to have a conversation. If you want to do it by heart rate, you can, and don't worry, we'll have this on our website for you as well. So start with the number 220 and subtract your age. It's 60% of that.
So moderate exercise can be related to both aerobic exercise and also resistance or weight exercise. Both types of exercise are very beneficial for health. Aerobic exercise is very good for many cardiovascular risk factors like blood pressure and cholesterol levels, whereas weight training has benefits in protecting from risk of metabolic diseases like diabetes.
Then the question is, which kind of exercise is best? Aerobic, like walking or jogging, or muscle strengthening?
We did some studies on duration and intensities of exercise and what's most beneficial for blood pressure and cholesterol. And we found that it is a moderate intensity for a duration of at least 30 minutes that's required to give benefit. When we shortened the duration to 15 minutes, very intense exercise, we saw absolutely no effects on blood pressure. Similarly, when we increased duration but lowered intensity, the benefits were reduced. So it seems that moderate intensity for a duration of at least 30 minutes is important, and it's this type of research that underpins the current guidelines.
The other thing that people often wonder is whether higher intensity is better or going longer than the recommended 30 or 40 minutes.
The recommendations for exercise is that you achieve 30 minutes of aerobic exercise on most days. In studies that we've done, we can certainly show that you get very good benefits from doing 30 minutes of moderate intensity exercise at least 3 days a week. The benefits of higher intensity exercise relate more to increasing fitness levels rather than reducing cardiovascular risk factors. If you increase intensity, there's no doubt you'll increase your aerobic capacity and your fitness. But we've shown that a lot of the effects on blood pressure and cholesterol plateau actually after you've achieved a moderate intensity for 3 times a week.
Of course, there are lots of different ways of taking aerobic exercise, and again, people often wonder which is best.
There are many different modes of aerobic exercise. It includes things like running, swimming, cycling. They're all very beneficial for reducing cardiovascular risk factors. The modes of exercise where you're supporting your own weight, like walking and running, tend to use bigger muscle masses in it, and you can achieve a higher intensity quite quickly. And that's beneficial. On the other hand, those types of exercises are often associated with joint problems. So non-weight bearing exercises like cycling and swimming also provide good benefit as well.
There's a bit of controversy over whether, if you're just starting to exercise after years of sitting, you need to see your doctor for a checkup. American exercise guidelines suggest you don't if you're sensible, but Professor Bronwyn-Kingwell disagrees.
As a cardiovascular researcher, I'd say everybody should know their cardiovascular risk factors to start with, their blood pressure and their cholesterol. And it's essential if you're over 40 to go to your GP and have those risk factors checked before you start on an exercise program. And then when you do start on an exercise program, don't launch into it all at once. Start at a low intensity and build gradually over 4 to 6 weeks. Try some interval training where you increase the intensity for a few minutes and then drop it back.